of your hip as well as on the outside of your knee, these two things are connected. Sometimes the doctors will say it's an IT band syndrome, or sometimes they'll give you the diagnosis of trochanteric bursitis in the hip. Either way, those are just symptoms. Having the pain on the outside and having the bursa that's inflamed, or the pain that goes down into the leg, into the knee because of the IT band, that's a symptom. We've got to get down to why is this happening? And that's what we're going to talk about today, as well as giving you 4 exercises that can help with this kind of pain. And we won't even touch the knee, and it can give you some resolution down in the knee as well. Hi, my name is Stephanie. I am the owner of Empower Physical Therapy. And we help clients avoid surgery, injections, and medications. We often get clients that have had failed treatments in numerous other areas. And what we do best is really fit the pieces of the puzzle together to really find the true source of what is going on with you. So if you like our information, make sure you please subscribe to our channel as we put out content all the time. Let's get into a little bit of things that can refer pain into this area. So the first thing is, we always like to rule out the back, and we're going to kind of give you an exercise that's going to do kind of like a hip and back kind of stretch. But you can often have back pain back through here that refers the pain down into this part of the hip, and it tightens up. And so the muscle tightness is just a symptom. We have to get to why is that muscle tightening up to begin with? So one of the things we're going to give you is a stretch that's going to stretch the back and the hip. The other thing that can happen is a lot of times, because we're always sitting with our knees bent and we're always bending forward, and maybe we're running and walking and cycling, we always have the hip in this bent forward position. And that creates some issues within the capsule, the joint capsule of the hip. And it makes it hard sometimes for us to be able to fully extend the hip back. And guess what? If you can't extend the hip back, then what happens is you'll be using these muscles on the outside part of the leg in order to compensate for that. So we're going to go into an exercise that's going to help with that. Other things that happen that can cause pain on the outside is just the way we recruit our muscles. So we always go through, 3 phases of physical therapy. The first phase is mobility. How do the joints move? How does the back move? How does the hip move? We have to check those out. Then we get into stability. Where's the weakness? Where's the compensation patterns that might be creating some of these issues? And then we get into the functional exercises. So the exercise that we're going to be giving you today is we're going to give you a mobility stretch, and then we're going to go into a little bit of using a tennis ball to release some of the tightness. Now, again, if you don't get to why the tightness is happening, using the tennis ball will just treat a symptom. But with a combination of the stretches that I give you and some of the strengthening exercise that I give you, when you combine all that together, you're going to get some pretty good results. And then we're going to get into some strengthening exercise to really start working on getting the back of those hip muscles to fire and not the outside of these hip muscles to fire. So let's get started. So the first exercise we want to do is we want to stretch the hip, and this will stretch the hip and the back. And the first thing is you're going to have one leg up, and you can do this on the bed, and you'll have one leg up and one leg down. You'll start down here in this position, and you're going to just press up and really just stretch that hip joint. This also works really well on a couch because the couch has a lot more cushion, so that hip will dip down into some of that extension. But you'll come down and you'll go up and just breathe and exhale and really stretch the hip. If your arms are a little weak, you can bring them out in the front, and then you can kind of walk them back to really get a good stretch in that hip. Again, if the hip physically can't move, then you're going to have issues getting some of these muscles to fire, and you'll just be going in these bad compensation patterns. It also hits the back a little bit. It's a little bit unilateral. So you can always, if that kind of feels good, but it's not fully getting resolution, you can always bring both legs up on the table and stretch this way to get a little bit more of that back, if that's going to be causing some of those issues. But the first one really hits the hip and hits the back. So the next exercise that we can do, I'm going to give you 2 strengthening exercises, and then we'll get into kind of releasing that tightness. So the next one is we want to really work and focus on getting the muscles in the back, the lower back, and the back through here to fire, and not get the muscles up through here to fire. And so a great one you can do is you can have one leg up like this and the other leg back. It kind of puts the hip in a little bit of extension, And so what can happen, you're going to do is you're basically kind of going to do a clamshell where you kind of lift up and then come back down. And you should feel it back in that lower part of that hip. Lift up and then come back. Now you can change the angle. Some people can't even lift up their leg when they're like this. They may have to come a little bit more forward in order to do that. But you're just lifting that knee up to really get that lower part of that glute down in through the back part, in through here to get it so that we're not getting it through here. So you can do that exercise about 10, 15 times, a couple times a day. The stretch, again, about 10 times. Get up, breathe, and then come back down and do that again a couple times a day. Now, the next one is going to be a bridge, and I like doing this one with a step because a lot of times when you do a bridge and your feet are on the ground, what happens is you're going to get your hamstrings involved a little bit more, and we really want to get our hip extensors involved. So what we're going to do is we're going to lie on our back and we're going to put our feet up on the step. And you can do this with both feet up, but what I want you to do is you're going to kind of tuck a little bit and you're going to lift and squeeze the glutes. Really squeeze those glutes when you come back up, and then you'll come back down. You can make it a little bit harder. So say like this side is, we need to work this side a little bit more. You can make it harder by bringing the other leg out a little bit farther so you still have support, but this leg that's working is going to have to work a little bit harder. You can also progress this exercise by taking your foot completely off the step and lifting up and squeezing that glute as you come up. So those are variations of the same exercise that you can do. And the focus is getting those hip extensors to start firing so that we don't fire in through that hip muscle. And again, doing about 10, 15 of those a couple times a day to really get those muscles to start firing. So the first one I would do would be the stretch, make sure that everything is moving, and then you get into some of the strengthening exercises. The last one that I'm going to show you is going to be with a tennis ball, and this is just going to release some of the tightness. And just because the joint starts moving, because things have been sticking around for so long for people, you'll just get that shortening of the muscle because it's been protecting for so long. So if you get the joint moving really well, then you can go work on releasing some of the tightness because you're going to notice that you're going to get a much better release. It's going to stick. It's not just going to come back a day later. So here's a tennis ball, and what we want to do is you want to stick it. You can do this up against the wall to make it a little bit easier, or you can do it on a table, but you can find different spots, and you're going to find them all through the outside. So you have like your hip bone right here. We can get it all in through just on the out inside of that hip bone, all the way through here and all the way through here. So if I place it, you can use this leg to help support you, and you just kind of lie on your side, and then you can kind of roll. And you roll until you find some spots that are really good. You may have to go down onto the elbow to go onto your side. And again, when you find the spots, hang out there and breathe. And then find another spot. And you'll find spots on there that don't feel very good. But if you hold them and you breathe, it's gonna help release some of that tightness, some of that shortening that you're having. So there you go. There are the 4 exercises to really help with that lateral hip pain and that knee pain. And what you'll notice is if you work up through here, the pain down on that outside of the knee will go away. We literally have had clients that they went to other physical therapy going, I don't understand what's going on. They're dry needling their knee. And, we're talking to them and we're asking, how's the back? Well, the back feels pretty good. I've been doing these things, but I'm still getting a lot of hip pain. Sure enough, we went and we saw their hip wasn't moving. We got the hip moving. We did some joint mobs and soft tissue release kind of at the same time. We have a technique that we use here. And then we started adding strengthening. But within the first visit, her knee pain went away. And everyone else in that medical system that was looking at her knee was looking only at her knee. They weren't asking her other questions as to what's going on in the hip. Is there anything going on in the back? Because these all can refer down to that knee. So these are some great exercises. If this is something that does not work for you, there's another source. There's other sources that can create some of these issues, and you can check out the link in the description. There's other videos that you can check out to learn a little bit more about other things that we can do when we have some hip pain. Okay, I hope you enjoyed the information. We'll see you next time.